Hi, guys. Welcome back for our daily practice questions. As always, I like to get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey, y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, one-on-one sessions, Q banks, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. Now, y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AAMP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that and include that so there's no confusion. So, that being said, let's get into our questions for today. And before we get started, I wanted to slide this in really quickly. Um, You've probably seen it and heard me mention it. In the past, I have done a membership and it went well. So I'm relaunching my membership per request, but this one is geared for the new nurse practitioner. There will be other tiers in the future, but right now I'm doing the new MP as once we get through and passing boards, I find that a lot of you are reaching back out and asking questions about credentialing and about your offer letters and um, even though you may have support in that new role once you get it, still just not feeling as confident to ask certain questions or wanting to run certain things past someone. And I want to be that resource. I always say to utilize, your supervising or other colleagues, and I'm big on that support system and having that person in all specialties because you will do that. I've been doing this. It's almost 10 years as a nurse practitioner. And if you're familiar with me, I am family, but cardiology is my background. And just that resource of running things down, like I would reach out to certain people in pulmonary, when we had certain things. A lot of my MP friends and colleagues, they always reach out to me about their cardiac needs or to run an EKG past me that may look a little bit different than your standard things that you may see. So it is great to have those resources. But when you're starting out, you're trying to build that. So with the new MP membership, we will go in per cohort so that even if you remain in later, when you're starting, I don't want it to be in a space that you've missed certain things that we covered. So it'll start to kind of formulate as a group. So if you are in this phase, y'all are going through it together, and you can choose to stay in and support the next cohort and continue to gain and learn and utilize the resources, or you can opt out as you move forward. But I'll be doing enrollment for cohorts every 3 months. So our first cohort for this starts September the 9th, which is on Monday. Today is the last day to join and enroll. It is $29.99 per month unless you are on my other membership. You'll receive a discount. But with this, if you have any credentialing questions, we cover those things, interview style questions, how to have your CV resume prepared so that you're able to be noticed and get your things out of the pile or off of someone's desk so that you can at least get to the interview stage. The negotiation, once you do have an offer letter, looking at the important parts and making sure that you're asking for those correct things because you don't know what you don't know, right? SOAP notes and understanding strategies and how to effectively document and have adequate time management, and other various resources that are impactful on that first year or more into that role, because also you may be an NP longer than 1 year, but you may be working in a different arena. So say you were doing family and now you're going to a specialty, you're going to cardiology or pulm or urology, whatever. It's a different strategy. So having all of that, so we will have people from other specialty speaking. You will have mentorship options and resources that you're able to ask other people in those specialties to help you as well. Okay. So I just wanted to throw this in because today is the last day to enroll to join this initial cohort. You'll also have access to different offers, partnerships with scrub companies and things of that nature. So it's going to be a lot of good things coming along, and I'm excited to start this new cohort. So if you're joining us, I would love to have you, and the link is in the description. But let's get into our questions for today. Question number one: the nurse practitioner and NP student have been discussing macrolides. Macrolides are used to treat all of the following except: is it A, sinusitis, B, pneumonia, C, asthma, or D, H. pylori? Take a moment and tell me what you have in the comments, you guys. All right, so I always recommend reading the stem of the question first, as the stem allows you to see what they're truly asking you. So it allows you to slow down and pay attention to what the question is really asking instead of getting caught up in the fluff of the scenario. And sometimes all of those parts are not significant, so I want you to pinpoint what they're asking and then read it all together to determine what you need to answer this question. So here the stem of the question states, macrolides are used to treat all of the following except. Now, except means we're looking for the incorrect answer, right? So think about macrolides. Macrolides are what? They end in myosin, MYCIN. So, our common ones are azithromycin, erythromycin, clarithromycin, the mycins, right? Your macrolides. So we know, if you think about it, it does all of that respiratory style things, your sinusitis, your pneumonias, your tonsillitis, your pharyngitis, your otitis media. Commonly we utilize our medicines for those, right? Um, we also utilize it for like H. pylori. So think about it. And if you got stuck on that, think about our triple therapy, quad therapy. Clarithromycin is that one that we utilize along with your amoxicillin and your PPI, right? So it does also treat H. pylori. So the best answer here is C, asthma. We don't use macrolides for the management of asthma. So C is your best answer. All right, question number two. The nurse practitioner and NP student are discussing adverse effects associated with macrolide use. All of the following are adverse effects of macrolides except: is it A, dizziness, B, nausea and vomiting, C, diarrhea, or D, abdominal pain? Take a moment and tell me what you got in the comments, you guys. All right, so here the similar question states, all of the following are adverse effects of macrolides except. So again, except is here, we're looking for the incorrect answer. So we're looking for something that is not an adverse effect of a macrolide, right? So is it A, dizziness, B, nausea or vomiting, C, diarrhea, or D, abdominal pain? Here, your best answer is A, dizziness. And when in doubt, think about it. When you think of even being a child and maybe needing antibiotics, anytime you're given an antibiotic, one thing we try to tell you to do, put at least something light on your stomach because it can upset your stomach, right? Nothing's changed. So now that you're the provider and prescriber, don't forget those small little things. So A is the best answer, dizziness, because that's incorrect. That's not an adverse effect of a macrolide use. But macrolides can cause nausea and vomiting. Macrolides can cause diarrhea. Macrolides can cause abdominal pain. And in the event that these things are severe in nature, of course, you let your patient know in advance that these are common adverse effects. Tell them things such as eating crackers or some toast before to kind of coat your stomach before taking these. But if they have this and there's some severity to it, then you know that you can stop it, try a different macrolide. Sometimes utilizing a different macrolide, their body may respond better, or going to that second line therapy if warranted. Okay. And then lastly, what is a contraindication of macrolides? Is it A, hypertension, B, asthma, C, prolonged QT interval, or D, abdominal pain? Take a moment, tell me what you got. All right, so here the stem of the question is the question. The question is the stem. So, what is a contraindication of macrolides? And this is just something you have to know. So, C is your best answer. This may seem strange, but macrolides can prolong the QT interval. So, of course, if your patient has a history of prolonged QT interval, you don't want to give them the macrolide. If they are on antiarrhythmics, if they have various arrhythmias, etc., you want to focus on this. We definitely need a baseline EKG, but you have to do risk versus benefit on this. But if there's other options, you want to go with the other options in those scenarios if they already have that history of the prolonged QT interval. So again, your best answer is C. All right, you guys. I hope you found this helpful. I wanted to go through some of the antibiotics. I get a lot of questions from reviewers on antibiotics, and with my one-on-one sessions that I've been doing this week, a lot of y'all have been getting hung up on antibiotics. So I'm going to incorporate some of these questions a little bit more. So some of them may seem more knowledge based. So um, even when they're not in the format of a test question per se, you'll notice sometimes that I'm putting things in here to help with your studying so that you are reviewing it, making sure that you're understanding it and knowing these things. So when it is in a question format, you know how to apply it because you have to have that foundation. So whenever a question is delivered to you on boards or exams in schools, you can pivot in any direction because your foundation is solid, right? So I'm big on that. So again, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. I appreciate all of your sharing and your subscriptions. Um, it helps the channel to be more visible to more people who may need it. I commonly get this thing that said they wish they knew me sooner. But it's just how it's displayed out here. So it helps me to help others when y'all subscribe and share and get it in the algorithm. So thank you, thank you, thank you. And also, if you need any other resources that I offer, feel free to reach out to the nursing studio. You can give us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. Things that I do offer, I offer a review book. You can get it in the paperback option or you can get it in an ebook. Both are linked in the bio of the channel. Is whatever preference that you have is designed for family as well as adult gero, broken down by systems. So you can also, with those links, check out a preview of those things so you can see if that's what you need that'll work best for your studying and learning your learning needs. Now, if you're someone who prefers to study independently, I have a self-paced virtual review broken down by system, designed for family, adult gero, and it is designed for both exams, the ANCC as well as AAMP. There are many quizzes throughout, and it's designed so you can have an idea of the format of questions for both exams. My 5 week intensive review, the final one, it is a group review. It's the last one for this year. I do have still one slot remaining. Today is the last day for enrollment as class starts on Monday. Um, I'm excited to work with y'all, this final group for the year. And then my QBank, all the QBank options are linked in the bio of this channel as well. That 5 week review link is in the description of this video. And then, my one-on-one sessions. Now, one-on-one sessions, I always tell y'all, always say, it is customized. So it's gauged off of what you need. So I always say to reach out to us so that we can determine what works best for you and what's going to be your the best avenue for you to take, because there's various things that we run into. This may be your first time taking boards and you want to just bounce some things off and see if you're ready. Some people just struggle with a certain area and need someone to kind of help them through. I have some people who have been unsuccessful a few times in the past, and they're just trying to figure out how to navigate differently and figure out where the deficits are. So I have resources for one-on-one sessions for all of those. So I like to speak with you and see where you are so that I can tell you what is best for you at that time, and then we can proceed with getting you scheduled for a one-on-one session. But again, if you need any of the resources that I offer, feel free to reach out to us. But y'all know what to do. Make sure you meet me back here. Happy studying. Bye, y'all.